This is Talking Points with Preferred Health Magazine. Today we'll be speaking with Dr. Erin Nance. She is an orthopedic surgeon. She's written a book called Little Misdiagnosed, A Surgeon's Guide to Breaking Bones and Bending Rules. In our conversation, she addresses systemic sexism in healthcare and ethical dilemmas in the ER. Let's listen in. Coming on, speaking with me today. It's so good to speak with you this morning. A wonderful memoir out called Little Misdiagnosed, which I love the play on words there. In your memoir, you're weaving together humor, sarcasm, raw honesty, as you share your journey as a female orthopedic surgeon. I wanted you to just kind of tell us a little bit about your book and what inspired you to write your memoir.
Of course. So, my memoir was inspired by my stories that I, grew up with. My path to becoming a surgeon, what it was like being kind of like a behind the scenes view of being a female orthopedic surgeon. And I started sharing these stories online a few years ago. And I always felt like everyone has one Netflix worthy story about themselves. And for me, I knew that story was my story of my first day of work. I had wanted to be an orthopedic surgeon since I was 7 years old, and I broke my arm and was treated by the same doctor who I was then under his tutelage at Lenox Hill Hospital.
Wow.
So it was this amazing full circle moment. I, went straight through college to medical school to residency, prepared. And my first day of work, it's July 4th weekend. It's, the craziest time in the hospital. Everybody's new. Nobody knows what they're doing. And I was starting on night float, which is probably the scariest thing as an intern to start, right? You're in the hospital kind of alone by yourself.
Right.
Nobody's there to help you. And I get a call from my mom. And I'm like, Mom, I'm at work. It's my first day. Like, stop it. Like, don't call me. And I just kept, ignoring her, but she kept calling. And so finally I picked it up. I go, Mom, I'm at work. What's going on? And she said, it's Kevin. It's your brother. He was in an accident in the pool. I don't know much about it, but they're taking him over to the hospital. And I said, listen, it's the first day of work for everyone. Like, make sure, attending radiologist reads the film so they don't miss anything. But I was just kind of trying to focus back on my current job. And then a couple of moments later, I got a call from my middle brother. He said, I know, Kev, he got hurt. He goes, no, I don't think you understand. He can't move. He's being airlifted to Stony Brook Hospital. And that was the moment I realized that he was paralyzed. And he had broken his neck and was a quadriplegic. So that was, I wasn't obviously expecting my first day of work where I'm supposed to be taking care of patients for that patient to be my own family member. Right. And that's really how the book starts, is my journey to being a doctor, but having that experience that shaped how I became a doctor.
I mean, scary, right? Obviously, you're already, like you're saying, it's your first day. You're already thrown into, you're not even sure, and then here comes your first patient, really, your brother. The book also highlights other experiences that you had as an orthopedic surgeon, a female orthopedic surgeon, and it's not something that's uncommon. I've actually heard a lot about this from various surgeons, and I'm not sure maybe if it's the specialty so much as it being a case of systemic sexism. So there is this happening. Can you share kind of a specific moment in your career that encapsulates those challenges and kind of how you had to deal with them?
Yeah, I mean, I think what I write about is that me talking about my experience as a woman in orthopedic surgery, I thrived in that environment. I loved my mentors. I, did really well. But what I learned was that by just accepting the environment, I was also making it harder for the next generation of women who it's not right? It's not appropriate. And I tell this story of, it was actually, I was just become chief resident it was my first day as chief resident, and I'm walking into our ortho resident lounge. Okay. And this is a lounge, you can only imagine what, a height, like a locker room. Okay. There's pictures of, penises on the wall. There's sports, calendar, women in bathing suits and bikinis. There were like maxi pads taped over people's lockers. And like we had lectures in that room. I mean, this was like a room like every day. And
you're like, where am I? You're probably like, is this the medical field?
Correct. This was our room. And I was about to make the schedule. I came in late at night to make the schedule for the next day. And one of our junior residents was being crushed with consults. And what I write about in the book is it's, a longer story, but he was gay and had not come out. Mm-hmm. And I just looked at him and I could tell that he was miserable. And I thought, how awful to have to come into this room, this environment, where it is like so clear that, you are not accepted and welcome. And so that night I said, I don't know how this podcast is, censored, but I said, I'm taking all the dicks down. And I took down all the pictures, all the calendars, all the paraphernalia. And I said, this is going to be a place where everyone should feel like welcome and included. So that was, what I understood was I didn't have that ability until I was in the position of power, right? Until I became the chief resident and I felt confident enough that I could make this decision. And it's something that I hope is part of my legacy.
Right. But in your book, you also described lying to hospital administration to secure life-saving surgery for a homeless woman. This I love personally. How did you navigate kind of those ethical dilemmas like this? And what do these moments kind of reveal about the broader healthcare system?
I think there are, and it's funny because I wrote this book before the election, before any of the most hottest, topics have come out. But what I realized is that it's the same problems we have had. This story happened 15 years ago.
Right.
Okay? So stories about getting just access to basic care, which involves respecting human dignity. And in this case, it was a homeless woman who had been attacked. She had a pretty severe injury to her arm, but what people may not understand about how the emergency room works, right? Emergency care is really only limited to, are you dying or are you not, right? And if you're not, then you go home, right? And I liken it to, you may have torn your ACL, which needs surgery, but you don't need that surgery to happen right then and there, right? So it's a procedure that for her, yes, she broke her arm, but it wasn't an emergency type of surgery. But I knew that if she was just released, no one was ever going to electively operate on her. And so I, made the decision to say, I think we need to admit her, because I wouldn't necessarily say that I lie, but I would say that I emphasize a possible, scenario where she could develop something called compartment syndrome. And I said, I would like to observe her for compartment syndrome and operate as soon as possible. And, when you go down that path, then you're able to actually, do surgery under emergency circumstances. So in that sense, I felt, taking my own, things into my own hands, that for the benefit of this woman, this individual, she needed surgery that night.
Right. Now, you say it for the ER specifically, but do you find that in other cases? You do? Is that a yes?
Well, do you mean that there's
other
difficulty getting care? Or?
Yeah, that there's a kind of a lack of sympathy or empathy for the patient, when it comes to, I guess, you're saying she was a homeless woman, that's maybe one thing, but do you find that also with different races or women and men, or how do you see it?
Yeah, I mean, there's absolutely bias within the medical system. That is 100%. There's bias against gender, against races, about socioeconomic status, whether or not it's conscious or subconscious, ability to pay. I don't think there's any doctor who is going around saying like, well, I don't want to operate on someone, who has Medicaid. But certainly, that's how our system is laid out, right? You have physicians who are part of the public hospital system, and then you have physicians who are, out of network. And so I think, unfortunately, we have a class system when it comes to our healthcare, whether or not we want to admit that or not. Not just anyone can go to the Mayo Clinic.
Right.
Not just anyone
Right.
can go to the hospital for special surgery.
That's right.
So we as a society have to decide, well, how do we want our healthcare to be administered? And I think, how are we judged as a society is how we treat the most vulnerable. And so I think this is a larger conversation about
Sure.
how healthcare is delivered, whether or not healthcare is considered a human right. I think probably for most doctors, the purest form of medicine that we practice is when we're a resident, because we have absolutely no skin in the game as to
Right.
who is the patient who is in front of us. It could be the CEO of Fortune 500 company or someone who just got laid off. They have a broken tibia. We want to fix it.
Right.
Okay.
Right.
And I do feel like there is this pureness in the practice of medicine when we don't have to deal with those outside factors. But again, we have to be honest. Doctors are operating within a business.
I know.
Right.
Right. And that's the whole thing. I know a lot of people need to see it like that as well. I say that all the time. I work with a lot of doctors also. So it's kind of like you're a practitioner, but you're also the business. You're also the brands. There's a lot of things that come with that. It's not, what it used to be, I guess. I mean, but we've come so far too, and there are different levels of care. So I get that. That is a larger conversation though. We should have that one. Let's get back to the book.
No, I mean, this is really, the point why I wrote this book is it's a memoir, but it's really the stories reflect the actual, circumstances that happen every day, right?
Yeah.
That, one of the chapters is about a man who gets laid off and he doesn't pay for the Cobra, right? And then he is involved in a dog attack in Central Park and he has to pay $15,000 for rabies shots. Right. Like these are things that are happening all the time. Like one of the chapters is about a man who was an undocumented illegal immigrant. He was on a work site. He fell. He needed to have emergency surgery, but he refused the surgery because he was worried about being caught in the hospital. And so I, devised a way for him to be operated on under a John Doe. So again, these incidents happened 15 years ago, but they're still so relevant to today.
One of your favorite cases, okay, and from the book, and what it taught you about medicine or yourself.
Well, one of the cases that I talk about, and it's actually an example of a time that I failed really as a doctor. My first patients on the ortho service, and it's pretty rare for patients to die after getting orthopedic surgery. It's usually elective procedures. They're mostly healthy people. They're getting a knee replacement. They may get a carpal tunnel. But it was a woman who, the night shift passed her off and said, oh, I don't really like how she's looking. Her breathing is more labored and her heart rate is going up and her blood pressure is going down. And I spent the entire day trying to figure out what was wrong with her, why this was happening, trying to order every test, calling in consults, trying everything. And in the end, I end up figuring out what it is, but it's too late. It's too late, and we lose her. And one of the main points of that chapter is right before I realize, we are about to lose her, I make a phone call to her daughter and I say, I need you to get here as soon as you possibly can. There's no time to waste. And she gets to the hospital and she's able to, hold her mom's hand as she's being wheeled into what becomes her final surgery. And it's moments like that where we realize, yes, we lose patients all the time. There are risks to having surgery. But if you are able as a doctor to go above and beyond and to lead with kindness and to put yourself in that patient's shoes, what they would want and what they need. And this goes back to my own experience with my brother's injury about how important it is to keep the family involved and keep them, in the loop. And I just was really glad that I could provide that, moment of connection right before she did pass away. Correct. I mean, it's something that, you don't expect, but you have to be prepared for. And that's why we do so many years of training. It's why we do, orthopedic surgeons train in general surgery first, so that we are able to work with patients who generally are sicker and have more complications. So, I would say that I want people to feel like they are in good hands when they go off to have a procedure or surgery. And part of that is having trust with your medical team. And I think that the best way to build trust between the doctor and the patient is having the best possible lines of communication, being educated, and feeling like you have developed this partnership with your doctor. Correct. So I started my social media platform because I solved a woman's 10-year medical mystery in 3 seconds, but not in my office. It was on the
right. Yeah.
And, that interaction made me think, number one, why did it take this woman 10 years to get an answer?
Exactly. Yes.
She had seen 5 doctors, so it wasn't as if she wasn't trying to get help. But one of the things that I learned from one of my mentors is that the eyes only see what the mind knows. Okay. And so if your doctor, in this case, this woman had a very rare tumor called a glomus tumor under her fingernail.
Wow.
Now, what she did not know is if you go to Google and put in PubMed glomus tumor, my maiden name comes up, Erin McDermott, because I'm one of the world's experts on glomus tumors. Okay. But she didn't know that when she DM'd me. She was just looking for someone who would believe her.
Right.
Because someone could help her. What soon snowballed was that I was getting 10,000 messages a week of people asking me to share their story so that one person wouldn't have to go through what they went through. And that's partly what we do on the Medical Detectives podcast. Is really not so much a medical podcast. It's more a patient storytelling podcast.
I love it.
We just facilitate the patient sharing their story. I'm there to have a little bit of medical, background and provide some context. And my co-host is a woman who has had lifelong medical issues, and she doesn't know anything about the case or the story before we start. So she just has kind of the normal natural reactions that a listener would have and types of questions. But I really love kind of repositioning the patient as the hero in their own diagnosis journey. Did a TED Talk a month ago called "You're Not Crazy: The 7 Stages of Misdiagnosis."
I love that. Wow.
Because what I realize is that we need an emotional framework to understand what it's like to go through that process, through that journey, and to understand that it's normal to be in denial at first. It's normal to feel anxious when no one can tell you what's wrong. It's normal to doubt yourself when everyone's telling you you're fine, it's just anxiety, it's all in your head, right? It's normal to feel depressed when you're not getting any answers.
Right.
So I really want people to, again, like validate those feelings that these are like normal part of the process, and then come up with some solutions to like actually get you a diagnosis and avoid those later stages of depression and apathy. Like the number one thing when we interview women or it's primarily women on the Detectives podcast, they say the same thing. They felt so alone in the journey. And what's crazy is that you may have endometriosis and feel so alone. There are millions of other women who also have endometriosis.
Absolutely.
And what we should be doing is lowering the barrier to making those connections.
We find this book. Where is this available?
Yes, the book is available everywhere. Right now it's in pre-order, so you can get it on Amazon, you can Barnes and Nobles, your local bookstore. But after launch on June 3rd, it will be everywhere. And then if you're on social media, TikTok is my main platform where I'm at Little Misdiagnosed. The podcast, which is The Medical Detectives, airs every Wednesday, and you can find that on Spotify and Apple and all places you get podcasts.
Wonderful.
And then where I hope we can all contribute to the conversation is on Feel Better, which will be available in the App Store on June 20th.
And that is Feel Better, FEELBETR.
That's right.
Okay, and we'll put that up on the screen and everything for everyone to see. Thank you so much, Dr. Nance, for coming on today and speaking about your new memoir, your new platform, your podcast show. So educational. We love what you're doing, and we love how you're paying it forward to these patients and really the world at large.
For the opportunity, because your readership is such a highly engaged audience. They really are proactive in wanting to take care of their health and learn lessons. So it's been an honor, and I can't wait to continue the conversation.